Hello, everyone. My name is Leanna Davis, and I am an assistant professor of kinesiology at Texas A&M University, Corpus Christi. I'd like to thank you for choosing to listen to my digital presentation titled Physical Activity Patterns and Health-Related Fitness Indicators in People Living with HIV. To give you a bit of a background, this project was part of a much larger interdisciplinary research study led by the International Nursing Network for HIV Research. So people living with HIV are at an increased risk for many chronic diseases. Most people living with HIV do not meet current physical activity recommendations, even though they stand to benefit from them. Physical activity is safe for nearly everyone, including people living with HIV, and it can improve or maintain their health as they live with this chronic condition. Hispanics and Latinos are the largest minority group in the United States and have higher rates of HIV infection compared to some other ethnicities. However, Hispanics consistently report lower levels of physical activity compared to non-Hispanic whites. And there's limited research regarding Hispanic people who are living with HIV. So the purpose of this study was to examine the relationship between physical activity patterns and health-related fitness indicators of adults living with HIV in South Texas, which was our study site. In total, we had 172 participants, most of whom identified as Hispanic or Latino. Recruitment and data collection took place in a community health clinic. So those included in the study had to have no medical contraindications for exercise. They had to be able to be physically active without an assistive device such as a walker, cane, or wheelchair. And they had to be able to communicate in either English or Spanish. Otherwise, they were excluded from the study. Data collection took place during a single visit on one of numerous scheduled data collection days that occurred at the local community health clinic between April 2016 and March 2017. The primary predictor variable was physical activity, which was measured by a 7-day physical activity recall, or PAR. A 7-day PAR is a semi-structured interview that estimates participants' time spent in light, moderate, and vigorous PA for the 7 days prior to the interview. We later totaled that amount. The outcome variables were cardiorespiratory fitness, muscular strength, flexibility, and anthropometrics, which corresponded to each of our 4 research questions. Cardiorespiratory fitness was assessed using the 6-minute walk test, or 6MWT. Participants walked as far as possible for 6 continuous minutes in a 30-meter-long pre-measured course. In our case, it was in a hallway, and the distance was marked. Muscular strength was measured by hand grip strength in each hand, left and right, using the handheld dynamometer. Flexibility was measured by the back scratch test for flexibility on both sides, left and right. And finally, anthropometrics were measured by the study staff. BMI was calculated after measuring participants' height and weight, and hip-waist ratio was calculated after measuring participants' waist and hip circumferences. Participants also self-reported their demographic information on a survey. So you will see 7 tables in the slides that follow. Frequencies and descriptive statistics were calculated. Frequencies and percentages were calculated for all categorical variables, including gender identity, ethnicity, marital status, education level, and monthly income. And descriptive statistics were calculated for all continuous variables, including age, physical activity, total distance walked on the 6MWT, the percentage who achieved sex and age predicted distance on the 6MWT, hand grip strength, flexibility on the back scratch test, BMI, and hip-waist ratio. Given the large proportion of individuals who identify as Hispanic or Latino in Texas, and particularly in the South Texas region in which the study took place, where it is over 60%, ethnicity was a variable of interest in the analyses. So an independent samples t-test was performed to determine differences based on participants' ethnicity. Pearson's correlations were performed to determine whether any relationships existed between the predictor and outcome variables. This was performed for all participants, Hispanic Latino only and non-Hispanic Latino only. And then partial correlations were then performed to determine relationships between those same independent variables controlling for age. And this was also performed for all participants, Hispanic Latino only and non-Hispanic Latino only. A hierarchical multiple regression analysis, or HMRA, was performed to examine the unique contributions of light, moderate, vigorous, and total physical activity in explaining cardiovascular fitness, strength, flexibility, and anthropometric measurements. So feel free to review the profile of subjects as well as the descriptive statistics at your own leisure. In viewing these results tables, please note that there were 172 total participants, 105 of whom identified as Hispanic Latino and 67 of whom identified as non-Hispanic Latino. However, not all participants completed every test or answered every survey question, and just as well, some outliers were removed. So the totals that you see might not necessarily add up to 172, 105, or 67. Looking at the results of the independent samples t-test, just one statistically significant ethnicity difference was found between Hispanic Latino and non-Hispanic Latino participants, and that was for hip-waist ratio. You can see that in the bottom right-hand corner. Looking at these next four tables, there were significant positive correlations between total physical activity and right-hand grip strength, as well as between total physical activity and left-hand grip strength. And then there were significant negative correlations between light PA and hip-waist ratio, as well as between total PA and hip-waist ratio. And this is to be expected. One would think that with more physical activity participation, you would have a lower or more favorable hip-waist ratio. When examining Hispanic Latino participants only, there were significant positive correlations between moderate PA and right-hand grip strength, moderate PA and left-hand grip strength, total PA and right-hand grip strength, and between total PA and left-hand grip strength. And then after controlling for age, all significant findings remained, whether we are talking about all participants or Hispanic Latino only, all significant findings remained. You'll notice we don't have tables here for the non-Hispanic Latino groups, and that is because no statistically significant relationships were found when examining only non-Hispanic or Latino, whether or not we controlled for age. So results suggest that a relationship between physical activity and muscular strength might exist, as well as between physical activity and hip-waist ratio for this particular population of adults living with HIV, but not between physical activity and other health-related fitness indicators such as flexibility or BMI. Total PA was found to be a significant predictor of hip-waist ratio, accounting for 2.7% of variation in this outcome variable. There does appear to be some benefit associated with even low intensity physical activity for people living with HIV. In the case of Hispanic Latino participants, it was moderate. So there appeared to be some benefit associated with moderate intensity physical activity. Future studies might wish to examine strategies to increase physical activity, and particularly that of moderate and vigorous intensity physical activity in people living with HIV and Hispanic and Latino individuals who are living with HIV. Since the acceptance of this abstract for a presentation at the 2020 Shape America National Convention and Exposition, I'm pleased to announce that it was published in the open access journal Physical Activity and Health. I've included a link there if you'd like to view it in its entirety. If you have any questions whatsoever, please don't hesitate to contact me, Leanna Davis. I've included my work email address as well as my phone number. I'm happy to answer any questions that you have. I would also like to thank Shape America for this opportunity to present digitally. Although it's not in the format I expected, I'm grateful nonetheless. I wish that it could be in person, but I will see all of you next year, hopefully, at the 2021 Shape America National Convention and Exposition. Stay safe and stay healthy, everyone. Wear your masks, and I will see you next year.